And turning to the global Ebola watch, 3 states in the U.S. have come under fire after enacting new quarantine measures for suspected Ebola patients that some are calling a violation of human rights. Paul, last week, many people were welcoming stricter health screenings at major airports, but now people are up in arms over the latest move. Why is that?
Well, the new rules that were recently introduced in New York, New Jersey, and Illinois require travelers from West Africa that had contact with Ebola patients to submit to mandatory quarantine for 21 days, even if they do not exhibit any symptoms of the virus. Kaci Hickox, a nurse returning from Sierra Leone, was the first person on Friday to be isolated under the stricter measures. She is now reportedly taking legal action against the state health authorities, claiming her civil liberties are being violated. During an interview on NBC's Meet the Press on Sunday, the U.S. Director for Doctors Without Borders said she was completely confused about the orders.
We have put in place over the past few months protocols that are based on well-known medical science and accepted, and those protocols have been strictly followed by our staff. They consist of self-monitoring, very strict self-monitoring.
Meanwhile, the U.S. ambassador to the United Nations, Samantha Power, has begun her trip to West Africa to assess the global response to the Ebola outbreak. Power warned that more medical staff was urgently needed for the hardest hit countries and said it was important not to stigmatize health workers that travel overseas to help address the epidemic.